think quality has always been on the forefront of medical practitioners, but we tended to look at quality with respect to our mortality and outcomes. I think in the recent years, we're starting to understand that quality is much more robust when we look at the processes of care and not just the outcomes. And overall, I think there's been a much more diverse push to look at quality as if it were an improvement science rather than just small individual projects. So we specifically chose topics for our workshop that we felt were timely and meaningful to ICUs across the nation today. Specific topics we covered were patient transitions from one care team to another. We looked at central line infection in the context of maintenance bundles as opposed to insertion bundles, early mobilization of patients as a quality improvement metric. And so I think these are topics that we're hearing about more and more because they potentially have significant impact on our outcomes. One of the benefits of the workshop we held was to have members get access to the tools that were described in the lectures that were provided. So we, in essence, are trying to build a file cabinet of tools and checklists for members to be able to access. Approaching quality with hypotheses and doing hardcore statistics, doing real measurement to actually address whether or not our improvement is meaningful or not is starting to come to light. Again, I think we're focusing on structure and process now, where historically we've only tended to focus on outcome. And I think that's really giving clinicians a better understanding of how best to improve the quality of care for their patients.